Buonasera, benvenute a questo quarto round del campionato italiano giovanile di debate. Stasera si affrontano le squadre Campana Titans in posizione di proposition e la squadra sarda Dettori in posizione di opposition. È un dibattito preparato. La mozione è la seguente: This house will require foods already on the market to undergo the European Safety Assessment currently mandated for novel foods. C'era un Infoslide, era stata provvista, che recitava Novel Foods refers to foods introduced in Europe from May 15, 1997, whose marketing is currently regulated by Regulation EU 2015-2283. Possiamo cominciare il dibattito e daremo dunque la parola alla prima speaker della squadra di governo, Giovanna. Prego Giovanna, quando vuoi.
Okay, can you hear me properly?
Not really.
Because I'm in school, so now can you
Try
hear me
to
properly?
come closer.
Can you hear me properly now?
A bit better, maybe.
Okay.
Okay, speak
So
loud.
if everyone's ready, my speech will start in 3, 2, 1. Good afternoon, judges, opponents, ladies and gentlemen. My name is Giovanna Di Mazzo, and today we stand in favor of the motion. This House would require all foods already on the market to undergo the European Safety Assessment currently mandated for novel foods. In this speech, I will define the motion, explain the broader context and the problem we are addressing, outline our line of argument, and present our first substantive argument focused on health and safety as preventive public policy. I will start by defining the terms. By foods already on the market, we mean all food products currently and legally sold within the European Union. And by European Safety Assessment currently mandated for novel foods, we refer to the pre-market scientific evaluation conducted by the European Food Safety Authority under the Regulation 2015-2283. This assessment analyzes a food production process, toxicological profile, nutritional impact, and potential risks to consumers. This system already exists and is already used by the EU for the novel foods, so all the foods implemented after the 15th of May 1997. The European Union claims to regulate food based on science, risk analysis, and the precautionary principle. EFCA exists precisely to ensure that food placed on the market does not pose unacceptable risks to consumers. However, the current system draws a sharp distinction between foods based almost entirely on history. Foods introduced after the 15th of May 1997 must prove they're safe before entering the market, while foods already consumed before that date are largely exempt from comparable modern scientific assessment. But this is not just a health issue. It is also a market hygiene problem. When some producers are required to meet strict scientific standards and others are not, the market immediately becomes structurally unequal. Safety regulation stops being a neutral rule, and instead they become a competitive advantage tied to age rather than merit. Moreover, in a globalized economy, food markets are no longer purely national or regional. If Europe wants a credible international food market, because let's be honest, the difference is between traditional food and novel foods, but traditional food is not the same elsewhere. Like in Italy, something may be considered traditional, but what in France, it may be not. So if Europe wants a credible international food market, it cannot rely on fragmented and historically arbitrary standards. A market that wants to be international must be governed by transparent, uniform, and export-ready rules. So this motion is not only about applying an assessment procedure, it is about cleaning up the market, making it fairer internally and credible internationally. So we support this motion because a food system must protect consumers through prevention, ensure fair and scalable conditions for producers, and build trust and legitimacy in a global market. These are our three arguments, and now I will present our first, focus on health and on safety. Today, foods already on the market are mainly regulated through post-market control. So inspections, monitoring, and recalls once problems are detected. EFCA itself, in an article, acknowledges that chemical contaminants and other hazards are still regularly found in commonly consumed foods. This means that intervention often occurs after exposure has already happened. By contrast, the novel food assessment works before market entry. It identifies risks early, it evaluates exposure, and it allows the regulators to manage hazards proactively. So, extending this model to all foods does not assume that I accept.
Are you aware of the fact that the General Food Law, the Regulation 178, is actually a thorough control that is being made on every food?
Yes, I am aware of that, but as I said, I'm focusing on an article wrote by the EFCA, so the European Food Safety Assessment. And it itself, as I've already said, acknowledges that, okay, these procedures, of course, we do not say that they are not made properly, but EFCA acknowledges that the chemical contaminants and other hazards are still regularly found in commonly consumed foods. While on the other hand, they've checked that in the novel foods, thanks to these procedures, these hazards are less commonly to be found. So that's what we meant. So extending this model to all foods does not assume that existing foods are unsafe. That's what I wanted to say. But it recognizes a basic regulatory principle that's already been accepted by the EU. So the absence of evidence is not evidence of safety. And of course, these benefits consumers, especially the vulnerable groups. Think about children, think about the elderly, or the pregnant women. They are obviously more sensitive to cumulative and low dose risks. We understand that this process takes time. It takes time, it takes money to be made, to be ensured. But in food safety, we see time more as a diligence, not as an inefficiency. Because regulation is meant to slow down unsafe decisions, not to accelerate them. So we have shown that the current system is inconsistent, not only from an health perspective, but also from a market perspective. And this will be explained better by the two arguments that my teammates will make. And we also have shown that universal safety assessment aligns regulation with science and fairness. So, as I've already said, in the next speech, we will show how this policy benefits producers, enables international market, and strengthens the trust of consumers. So, for this, I end my speech, and I thank you all for listening to me.
Scusate, diamo la parola a Sofia, la prima speaker della squadra d'opposizione. Grazie Giovanna.
Thank you. My speech will start in 3, 2, 1. Good evening, I'm Sofia, the first speaker of the opposition team, and my argument will prove that reassessing every food product is extremely expensive and brings almost no extra safety benefits. Beatrice is the second speaker of our team, and she'll demonstrate that traditional foods have already been tested over the years and still are, and she also do the reply speech, and Camilla will do the first speech replying your argument. So, as the opposition, firstly, we strongly disagree with the motion that all food already on the market should undergo the safety assessments that are currently mandated for novel foods. And following our team line, which is that in order to guarantee health and safety, we should regulate food consumption rather than spending money on testing traditional food already regulated, I'd like to rebut what the first speaker of the proposition team has said. So, first of all, they misunderstood the meaning of traditional foods, saying that in Italy something can be traditional and maybe in France can't. Because we know that with traditional foods, we are talking about all the food produced and consumed in Europe before 1997. Then she stated that we need a basic fair regulation for all foods, and saying that we don't have regulation for traditional foods, and stating that there are chemicals that have been found and there are still found more on traditional foods than on novel foods. And I believe that the finding of a chemical in the making of the products has nothing to do with the regulation, but maybe on how people don't respect the regulation that they have already now need to undergo. So we don't need all the regulation for the novel foods to be for all kind of foods. We just need to regulate the consumption and the production of traditional foods, but they actually don't need to undergo the assessments required for novel foods. And now I'd like to go on with my speech. In fact, we know that the novel food safety process was created in 1987 for foods that are new and unfamiliar. So we are talking about food that have a little or no history of being eaten in the European Union. And in those cases, of course, spending extra money makes sense, as we don't know how our body will react over the time with the consumption of those food. But this motion treats all food the same. So we are talking about testing again pasta, cheese, milk, bread, and so foods that have been eaten for decades from all European people, and testing them again as if they were novel foods and unknown food. I accept.
I'm sorry. So are you saying that the conditions made before, historically, while we ate pasta and milk, are the same as today?
I'm just saying that if we know that we have eaten those food for all this time and nothing has ever happened, they doesn't need to undergo those assessments. And so I was saying that testing them again is unnecessary, as with testing them as if they were unknown. And following my argument, I'd like now to tell you some data on all of the costs that novel foods need, all of the novel food process. In fact, we know that the novel food process costs are very high, and for example, just the application that a company needs to do for the novel food approval is actually between 20 and 24,000 euros just for one product, and just for the safety assessment. And in many cases, those costs can reach higher costs. In fact, preparing the paperwork, meeting the EFSA requirements, and getting the approval, which is between 100,000 and 500,000 euros per product, and of course it can even be more. And this cost are already very heavy and difficult to manage, even if those foods are actually novel foods. And now we can imagine applying those systems to all the foods that we eat, so all traditional foods, and we can maybe talk about 10,000 products, which is a very low estimate, and those products maybe will cost 100,000 euros per product. So we are talking about 1 billion euros just to approve 10,000 products that we know for sure are already safe. And this cost is of course very higher than this 1 billion because we are considering the extra laboratory testing, maybe delays, and the need of having more staff for those to apply those regulations. And what makes this worse is that there is no strong scientific reason for doing this. And we know, in fact, that the European Union already accepted a past of 25 years of consumption of food from outside the European Union, from outside Europe. So if one food that have never been eaten in Europe comes right now in Europe, and it has a history of consumption of 25 years, it can be easily consumed for more Europeans. And this motion doesn't even consider this logic. So the regulators already trust the real world experience. And this is the main reason why we don't support this motion. And talking about times, we know that the system is also very, very slow. In fact, just after the application, the EFSA evaluation takes from 9 to 12 months. And then there are some, of course, administrative checks to do, and we are talking about 2 years of scientific evaluation. And this is the better thing that can happen. So that it can be very worse. And in fact, we know that there are a lot of delays. And if thousands of existing food were added to this process, the food authorities like the EFSA would be overwhelmed, and this would slow down their ability to respond to real dangers, and for example, contamination, food fraud, unsafe imports, and this following our team line wouldn't guarantee the health and safety that we need. And many groups, for example, we are as consumers will be harmed by this policy. And we know that all European people pay from 3,500 euros per year in a health system, and this doesn't include the cost that would get higher if all traditional foods would go under the assessment for novel foods. And if this cost increases, they maybe wouldn't focus on real health problems, for example, poor nutrition, obesity, or illnesses related to food. So in the end, I would say that food safety is about using resources well, and it's about focusing on real risk and not repeating tasks just to look strict. And this motion sounds protective, but in reality, it is inefficient, unnecessary, and very, very expensive. And for all this reason, the opposition urges this House to reject this motion. Thank you.
Grazie, 8 minuti. Ok, quando le altre giudici mi danno un cenno. Perfetto. Grazie Sofia. Diamo adesso la parola a Sara, secondo speaker della squadra di governo.
Good afternoon, everyone. I'm Sara Napolitano, the second speaker of the PRO team. Today we'll talk about sorry again. I'm the second speaker of the PRO team. I wanted to start by clarifying what the first speaker of the other team said. One thing that I wanted to clarify and to rebut is the fact that she kept on insisting on the fact that this process was not actually really important because of its cost. and the fact that it was more expensive than it should be actually affects the fact that we shouldn't do it. She talked about $24,000 being spent in that process, and that is why we shouldn't actually all these things under security assessment. So one thing my team stands for is the fact that um, the curves shouldn't actually really be that important when we're talking about safety, when we're talking about our population health. So in this speech, I will present two further arguments. One focuses on producers and the economy at both European and international scale, and one focuses on the consumer trust and legitimacy. This argument is about economic opportunity, not punishment. We openly acknowledge that EFCA assessment requires time and requires resources, and that this affects producers, particularly smaller ones. But the real question is not whether there is a cost, it is what that cost buys. Under the current system, many small and medium producers are effectively locked out of large-scale markets. Without recognized since by certification, they struggle to access to different things. They struggle to access to large retail chains, to cross-border trade, and to international export markets. By adapting to a harmonized safety assessment, producers gain something extremely valuable: credibility and scalability. We already see this logic internationally. In the United States, food producers must comply with strict federal safety standards enforced by the FDA, especially under the Food Safety Modernization Act. Producers who do not meet these standards simply cannot enter the US market. Those standards are demanding, but they also allow producers who comply to access one of the largest food markets in the world. Applying a comparable system in Europe allows EU producers to scale their operations, to meet international expectations, and to compete globally on equal footing. On the other hand, for small producers, this is not exclusion. It is a pathway that leads them to growth. Pre-market assessments replace informal barriers and unequal trust with clear, recognized standards. And it also protects them from catastrophic failures. A single recall can destroy a small producer. Predictable compliance is far less damaging than unpredictable collapse. Finally, this motion strengthens trust. EFCA was created after major food crisis, precisely because public confidence in food regulation had collapsed. A system where foods are scientifically assessed and the others are not, without a clear base justification, is difficult for consumers to understand and to accept even. Universal assessment allows regulators to say clearly and honestly, everything on the market is met to scientific standards. This benefits consumers by increasing confidence, reducing panic during scares, and supporting informed choice and trust. It's not it stabilizes markets, and it protects uh, producers from sudden demand shocks. Addressing the burden on producers' objections, if opposition argues that some producers may not survive these transitions, we have one only response. A response that is simple and a response that is principled. Our response is that selling food, it's not an unconditional right. It is conditional on safety. It is based on safety, on people's safety. This motion does not eliminate small producers. it actually, for us, eliminates unequal standards. Implementations can be phased, they can be proportional, they can be risk-based, but the principle has to be universal. This
Yeah,
motion
I,
is not I accept.
but what is not really clear to me is that if this motion wants to create an equal standard between big and small producers, how will it do that if the cost for the novel food safety assessment is so big to be applied, like if it should be applied to all foods?
The fact is that we're talking about the scale of that. So when we talk about this, small producers, we talk about the large scale that it actually affects, and the fact that not we're not doing anything. We make them equal to others. We're not talking about making some choices to how your house in the other end would do, actually compromise their equality when we talk about large scale or a smaller scale. Anyways, this motion is not only about health. It is about clean market, fair competition, and international credibility. By applying same scientific standards to all foods, we not only protect consumers, we empower consumers to care our food before, and we actually make the European food stronger and more global. For these reasons, this house should support the motion. Okay, thank you.
Grazie, 7 minuti e 51. Ok, grazie Sara e diamo pure la parola a Beatrice, la seconda oratrice della squadra di opposizione. Prego Beatrice, quando vuoi.
Okay, so my speech will start in 3, 2, 1. Good evening, I'm Beatrice Zedda, the second speaker of the opposition team. And before going on with my speech, I would like to rebut to what the first two speakers of the proposition team said. So first of all, they stated that food produced before 1997 is based almost entirely on history, and they claim that the history of use and consumption is not a scientific way, a good scientific way to make sure that a food is actually good for consumption. But we don't think that. We actually believe that the history of use and consume is actually one of the best empirical state of data that we are able to have right now. So I will prove through my speech the way that it is actually a good way of testing food. And also they said that we have to test our food with the novel food system because of how many hazards are found in food that is produced before 1997. But actually, we will prove to you with the metaphor, in my speech, I will prove to you with the metaphor of the scalpel and the sledgehammer to test our foods and to make sure that they are safe for consumption. We don't need to test all of them at the same time using this the novel food regulation system, because there are already certain laws that are established that make sure that our food is safe. And also they stated that this problem is so important, making sure that the food we eat is safe is so important that we should not talk about the cost. And this will be true because this is very important issue, but it will be true if we didn't already have some way cheaper ways, some alternative ways that allows us to make sure that the food we eat is safe, even one that is produced before 1997, without having to spend an enormous amount of money. And I will demonstrate that through my speech. Now I'm going to show how it's not necessary to apply the novel food regulation to food produced before 1997, because traditional foods have already been tested and continue to be tested, albeit using different methods. The proposition case rests on a flawed assumption that if a food was in the shelf before 1997, it is in a regulatory black hole. They want you to believe that we are choosing between history and science, but this is a false dichotomy. My partner has already illustrated the catastrophic economic and bureaucratic collapse this motion will cause. I will now prove that this collapse is being invented for a problem that modern science and existing legislation have already mastered. To understand why this motion is unnecessary, we must first recognize that the history of safe use is not absence of science. It is a robust, empirical scientific data set that provides more certainly than any one-time laboratory assessment ever could. The novel food regulation was designed specifically for unknown ingredients where no human data exists. But for traditional foods, we have something far more valuable: centuries of longitudinal generational data. When we consume a product for decades, then without adverse effects, we are conducting a real-world clinical trial on a massive scale. To ignore this data in favor of a new lab report is not more scientific. It is a denial of the most robust evidence we have, biological proof of safety over time. Beyond the scientific validity of history, we must look at how we actually protect consumers today, since the proposition teams seem to be so focused on consumer trust. The proposition argues that we need a universal standard, but they ignore that a universal safety net already exists, and it is updated constantly. We do not need a novel food regulation for traditional products because we already ensure their safety through modern dynamic laws that the proposition has completely overlooked. For example, look at the 2023 Contaminants Regulation. This law was uploaded only 3 years ago to set strict modern limits on toxins, heavy metals, and chemicals for every single food on the market, regardless of when it was first produced. When a specific risk is identified in a traditional process, such as the formation of acrylamide in high-heat baking, the European Union does not wait for novel food assessment. It acts immediately with target legislation like the 2017 acrylamide rules to force production changes across the entire industry. We use a scalpel. As I was saying, our metaphor is that we use a scalpel to fix specific risk. Meanwhile, the proposition team wants us to use a sledgehammer to smash the entire industry. Their motion will require the food industry to spend millions of euros to prove that a product is safe, while our current system spends its resources identifying and removing the specific things that make a product unsafe. One is an administrative box-ticking exercise. The other is an active modern public health surveillance. Furthermore, we must consider the impact of this sledgehammer on the future food. My partner mentioned that bringing a product to market is expensive, but we must specify and be specific about the cost of innovation. Research shows that if you include the full research, development, and regulatory path, the cost to bring one single truly innovative product to market can hit 15.4 million euros. By forcing every traditional fruit producer to divert their funds into redundant safety assessment for products we already know are safe, we are effectively killing the research and the development budget of the European food sector. This policy does not drive innovation, it freezes the European market. In the past, it creates a scientific traffic jam at the European Food Safety Authority, where the sustainable, climate resilient food of the future are stuck in a 10-year waiting line behind thousands of applications for traditional bread and cheese, food we consume every day, foods we know are safe. Because it is important to understand the traditional traditional use of this food is proved. It's empirical data. It's important. Ultimately, the proposition is asking us to replace a working, targeted scientific system with a redundant and dangerous administrative nightmare. We do not need to pay 15.4 million euros to re-verify the safety of pasta, cheese, bread. We already ensure its safety through a robust legal framework that monitors contaminants, additives, and production method every single day. We ensure safety through proof and practice, not through redundant bureaucracy. Therefore, we prove to you with strong evidence that it is not necessary to apply the novel food regulation to food that are produced before 1997. And for this reason, we urge you to oppose the motion. Thank you.
Grazie, 7 minuti e 34. Ok, se ci siamo, perfetto. Allora, grazie Beatrice. Diamo la parola a Giovanna, terza oratrice della squadra di governo. Mi raccomando, Giovanna, molto vicino allo schermo.
If you can just give me 2 seconds I need to write something down. Just 1 second.
Yeah.
Okay, I'm ready. Sorry. So, if everyone's ready, wait. Okay, the timer.
Yeah.
My speech will start in 3, 2, 1. Good afternoon, judges and opponents. I'm Giovanna again, and now I will rebut what has been said, analyze what has been said during the debate, and rebut what the other team has said. And then I will also sum up my team line. In this speech, I will respond directly to the main claims made by the opposition. And what becomes clear is that their case relies on formal regulation without scientific depth, selective definitions, and a misunderstanding of how modern food markets actually work. First, opposition claims that traditional foods are simply the foods that are not novel, and therefore do not require further assessment. But this definition avoids the real issue. Calling a food traditional only tells us that it exists on a certain date. It tells us nothing about how it is produced today, or at what scale, with which inputs, or under which environmental condition. That's why we gave as traditional food a more defined, a more specific definition. Because they talked about bread, they talked about milk, but bread today is not produced with the same wheat, is not produced with the same chemicals, or with the same processing methods, or the same global supply, the global supply chains as the bread of 50 years ago. It just simply does not. I mean, how much has happened since then? Climate change, all these factors that we feel every day, they affect the food. They affect the components of the food. So when opposition appeals to tradition, they are relying of their definition, they are relying simply on historical assumptions, not current scientific evidence. I accept.
Are you aware that the regulations that are currently in order didn't just stop after 1997? So they are still evolving.
Yeah, I will explain this better and while continuing my speech. What we're saying, you said you made the example of the 2023 regulations that is very recent, right? But in fact, you claim that we do not need this policy because the regulation already happens before the foods reach on the market. And this is a crucial point because yes, regulations exist before market entry and they exist for these traditional foods, but those regulations are largely formal and procedural. The FCA itself claimed it. Hygiene rules, labeling requirements, and general compliance obligations in the 2025 report of the FCA, they explained that they're not these hygiene rules, labeling requirements, and general compliance obligations. They are not equivalent to a comprehensive scientific risk assessment of composition, of toxicity, and exposure. And this is exactly what FCA does for novel foods. So you are confusing basic regulatory compliance with scientific safety evaluation. But our motion does not deny that regulation exists. It just says that the most robust form of regulation, so the scientific assessment, is applied selectively, and that this selectivity is completely unjustified. Um, then another thing that the opposition has argued about is that we should focus on real dangers, such as contamination. They made the example, instead of expanding safety assessment. And this creates a false opposition between two things that are not mutually exclusive, because contamination is precisely one of the risks that scientific safety assessments are designed to address. The difference is the timing, because post-market contamination controls intervene after food is already circulating. Pre-market assessment identify risks before widespread exposure occurs. So this is not about shifting focus away from real dangers. It is about deciding how we want to respond to the harm, if we want to prevent it. Then the opposition has also suggested that instead of regulation itself, we should regulate the consumption. The first speaker has said this. And this fundamentally misunderstands responsibility in food system, because consumers cannot regulate what they cannot scientifically assess, because they do not have the access to toxicological data or to exposure threshold or production chain risk. So shifting responsibility onto consumers' consumption is not empowerment. It is just the abdication of regulatory duty. Food safety regulation exists precisely because individual choice cannot replace scientific oversight. And now let me turn to what was clearly their central argument, the cost of these processes. They repeatedly argued that extending these EFCA assessments would be too expensive, especially for producers. And we acknowledge that there is a cost. But opposition didn't explain fully why cost alone should outweigh safety, fairness, and market coherence. Because I repeat, I said in the problematization, in the introduction of my speech, I said that we're not just talking about health, we're also talking about the market hygiene, the market equality. And more importantly, they ignore the costs of the current system. because the markets that the regulations that they refer to, the failures of these regulations, they lead to recalls, to legal liability, to loss of trust, and the sudden market exclusion, costs that are disproportionately destroy small producers. These assessments, on the other hand, replaces unpredictable disaster with predictable compliance. It is a one-time investment rather than repeated crisis management. And crucially, the motion does not require identical procedures or identical costs for every producers, of course, because they don't even require identical procedures and identical costs for every food, because it based itself on how they grow, where they grow, the risks. So it requires the application of the assessment framework, which can be phased, it can be proportional and risk-based. And finally, the opposition questioned why this policy would benefit producers at all in a POI that was made for my teammate. The answer is scale and access, because in modern food markets, especially at international level, access depends on meeting recognized safety standards. And we already see this in systems like the United States one, where producers must comply with strict federal
Scusate, scusa Giovanna, scusami tantissimo, ma mi ha buttato fuori dal Meet e quindi ti devo chiedere di riprendere perché mi sono perso più di 3 minuti del tuo speech. Chiedo scusa a tutti, ma ok.
Riparto
Ero arrivato quando hai risposto al POI di Camilla e hai preso l'argomento di selectivity is completely unjustified.
Ok.
Sono desolato, ma il regolamento prevede che per più di 30 secondi sia necessario far riprendere. Mi dispiace tantissimo, ma...
No, si figuri, ok. So,
Ripartiamo da 4 minuti e 45.
Okay. Okay. So, after that, I said that the opposition argued that we should focus on real dangers, such as contamination, instead of expanding the safety assessments. But this creates a false opposition between two things that are not mutually exclusive. Contamination is precisely one of the risks that scientific safety assessments are designed to address. The difference, though, is the timing, because the regulations, the contamination regulations that they have talked about intervene even before what is circulating, but the risk is not the same. The FCA in 2025 posted an article saying that these regulations, as I've already stated, do not focus on bacteria, hazards. I understand they've talked about the 2023 contamination regulations, but they are not as effective as these ones because the procedure is longer. I understand the timing is very important, but I think that it's necessary because, okay, they're safe, but do we really want the safe or super safe? So this is not just about shifting focus away from real dangers. It is about deciding how we want to respond to the harm. Then the opposition insisted on that the first speaker has talked about the fact that we need to regulate the consumption instead of food. And this is fundamentally wrong because it just doesn't understand, it misunderstands responsibility in food systems, because consumers, of course, did not have the same access to a scientist, for example. They do not have access to data, exposure, production chain risks. So shifting responsibility onto consumers It's not empowerment, it is just abdication of regulatory duty. Then they talked about cost. That was their central argument. They repeated that it's very, very expensive, especially for producers. But they ignore the costs of the current system as well, because the markets, the regulations that they are talking about, the failures of these, they lead to recalls, legal liability, loss of trust, and sudden market exclusion, costs that are disproportionately destroyed small producers. So our assessment replaces unpredictable disaster with predictable compliance. And crucially, the motion does not require identical procedures or identical costs for every producer. It requires the application of the assessment framework, which can be phased, proportional, and risk-based. And even the cost for, it's not even the same cost for every food. It's based on their risks. And so to sum up our team line, we have said our team believes that food safety regulation must be science-based, preventive, and applied equally. The current system relies on historical assumptions that no longer reflect modern production, creating health risks and market inequality. And by extending the existing EFCA safety assessment to all food, we protect consumers and the producers as well. So thank you all for listening to me.
Grazie, 8 minuti e 30. Ok, nella speranza che la tecnologia non ci abbandoni, non mi abbandoni come pare stia facendo stasera, grazie Giovanna, scusa ancora per l'inconveniente, diamo la parola a Camilla, terza oratrice della squadra di opposizione. Prego Camilla.
I will start my speech in 3, 2, 1. Good afternoon. My name is Camilla Nappi. I'm the third speaker of the opposition team, and my speech will consist of the rebuttal of what has been said by the proposition team, and I would also like some data to strengthen what has been said by my team. The first thing I would like to do is to rebut what has been said by the first speaker of the proposition team. One of the main points that the first speaker brought is that the market should be uniformed. This is a point that we are firmly against, because a market that is completely uniformed doesn't take in mind the fact that foods are different and they require different methods to be regulated. Just like you wouldn't use a raincoat to prevent sunburn, you would also not use the same regulation that is being used for novel foods to prevent problems with health caused by traditional foods. They also said and mentioned many times between all their speeches the fact that they acknowledged the fact that the assessment would take time and money, but they also acted like it would give us an efficient solution. We firmly believe that adding another unreliable regulation to an already fallacious system wouldn't cause it to remove unpredictable damage, but would actually cause it to remove one of the most important factors in the scientific method, which is observation and experimentation. This is what lacks in novel foods. Because they weren't largely consumed before 1997, we haven't seen which effects they could cause to people nowadays. We haven't seen what illnesses they could cause. This is what the EFSA is trying to regulate and to compensate. This is what lacks. The novel food and this is what the traditional foods have: an historical background that allows us to believe and predict what the problems will be with the food. The second speaker acknowledged the fact that the EFSA struggles. I accept.
Okay. Why should innovation be exempt from proving safety?
Non sento.
No, non si sente, avvicinati di più.
Why should innovation be exempt from proving safety?
Thank you. We believe that the problem isn't innovation. The problem isn't being attached to an historical background or traditions. The problem is that the system, the current system, is already evolving. It's currently trying to adapt with the times. We do not need to uniform the market, as you said with your first argument. We believe that the system is already evolving. The problem in health, hygiene, and safety isn't the fact that traditional foods is regulated in a different manner from novel foods. The problem is that people don't have the knowledge to consume those foods with the knowledge to act on what the food could cause. We believe that a plan for us, a counter plan, could be to help people have more knowledge on what the dietary problems could be on the consumption of foods. So, the second speaker also said that producers may not survive this assessment, and they acted like as if it was collateral damage. But we have historical data that prove that food can be initially believed to not be safe, to be unsafe, but then can be re-regulated, and we can see, for example, tomatoes. In the 17th and 18th century, people believed that tomatoes were poisonous, but actually it was because people were eating from pewter plates. That was the issue, so not the tomatoes in itself. This is why we need observation and experimentation, and this is what traditional foods have, and this is what novel foods lack. Which is why we believe that producers could have a lot, could be damaged, even producers that produce safe foods. You said that serving food is not a right. It's something that you need to gain. It's almost as if it's something that you need to win over. The problem is that producers that serve safe food could also have collateral damage from this regulation because people tend to misidentify risks. Even the EFSA, which your team pointed out, isn't completely reliable, quoting an article that was written by the EFSA. So, if we cannot trust the EFSA system, we believe that keeping those foods on the market and keeping them to observe the effects that they could cause is what we need in our current system. Because keeping those foods on the market while still obviously controlling them, assessing them, and regulating them is the only safe answer we have to this problem. Your solution, which doesn't come with an actual plan, you didn't bring us actual fact that could back what you're saying, is something that we don't agree with because we believe that the cost and time that you acknowledge but also somehow ignored to answer isn't something that you can just keep over or just not take in account. You are acting like this our assessment is an utopia that doesn't need time, doesn't need money, doesn't need anything to actually be initiated. We firmly believe that this is a factual problem. This is a current problem that we need to resolve. But we don't need another unnecessary regulations to a system that is already failing. We believe that trying to regulate food by reacting to the problems and not preventing them is the only solution we have. Also, we believe that the health problems that you mentioned with the current food system isn't because of traditional foods that fail to be regulated properly. We believe that the problem is based on dietary patterns, unsafe dietary patterns, because 50% of the adult population of Europe is obese or overweight. This isn't because we aren't assessing or regulating properly traditional foods. The problem is that overconsum people via an overconsumption of these foods fail to acknowledge that they are not able to know what is safe and what is unhealthy. This is the problem. The fact that people consume foods without fully knowing what the consequences could be. Also, I would like to finish my speech by saying that the problem that the proposition team is um, addressing is the fact that traditional food should be regulated. Well, we believe that traditional food is already regulated, and the problem is people the overconsumption of traditional foods. Thank you.
Grazie, 8 minuti e 15. Ok, se le giudici sono pronte. Abbiamo terminato con la parte costruttiva dei discorsi, possiamo cominciare con le repliche e cominciamo dalla squadra di opposizione. Prego Beatrice, quando vuoi. Vicinissima... Ah no, tu no, sono le altre, vicinissime al microfono. Vai.
Okay, my speech will start in 3, 2, 1. So, good evening. Before I begin with my analysis and reply speech, I would like to thank the proposition team for an incredibly interesting and thought-provoking debate. While we both share the goal of a safe food system, we have seen two very different visions of how to achieve it today. The proposition team line rests on the idea that universal testing is the only way to ensure safety. While the opposition's team line is grounded in reality, we think that in order to guarantee health and safety, we should regulate food consumption rather than spending more money on testing traditional foods that are already tested. To decide this round, we must look at the major points of clash where these two visions have collided during this debate. So first of all, the first major clash was over what constitutes a proof, what can be considered a proof. The proposition argued that we cannot rely on historical arbitrary standards and that traditional foods are effectively untested because they lack a modern dossier. The opposition won this clash by proving the history of safe use is not arbitrary. It is the most robust empirical longitudinal study available to mankind. We show that centuries of consumption by millions of people provide a level of biological certainty that a one-time laboratory test simply cannot match. We won this clash because we proved that science is about evidence, not just administrative figures. The proposition failed to explain why we should believe their claim. The second clash was over how we handle food hazards. The proposition pointed the risk found in traditional foods as evidence that they need to be tested the same way as novel foods. However, the opposition won this point too by showing the difference between a scalpel and a sledgehammer. We showed that when hazards are found, our current system uses targeted and dynamic laws to fix the problem immediately. The proposition solution is to hit every food with a sledgehammer. of novel food testing, a move that will cost billions and cause market paralysis without actually removing the hazard any faster. We won this clash because we proved that targeted regulation is a better guarantee of public health than redundant and expensive testing. Finally, the third and last point of clash was regarding the nature of safety oversight. The proposition described their policies as preventive, claiming that it stops risk before they happen, and while they characterized our approach as a more reactive one. The opposition won this clash because we showed that their vision or the vision of the proposition team is actually just a market paralysis in the end. By trying to prevent every theoretical risk in foods we have eaten for centuries, they effectively stop the block on food innovation. Our reactive system is, in truth, a dynamic and procreative one. It uses constant monitoring to identify and react to real emerging threats in the food chain. We won this clash because we proved it is better to have a system that moves with the science rather than a system that stands still while testing in a laboratory. At the end of this debate, the choice before the judges is clear. You can choose the proposition path, a word of administrative redundancy where we spend billions of euros and decades of time re-verifying what history has already proven, effectively paralyzing the food industry for a false sense of security. Or you can choose the opposition path, a word of targeted modern regulation that respects the empirical evidence of history while focusing our finite resources on real and emerging risks. We have shown this is not necessary to apply novel food regulation to food produced before 1997 because these foods are already monitored by superior dynamic framework, which is reality of rhetoric and efficiency over bureaucracy. For this reason, the opposition has won this debate and we urge you to vote against the motion. Thank you.
Grazie, 4 minuti e 18. Un attimo. Ok, grazie Beatrice. Diamo adesso la parola a Sara, che avrà cura di parlare vicinissimo al computer e a voce molto alta. Grazie Sara.
Okay. My speech will start in 3, 2, 1. Okay. Imagine our society as two different words. The first word is the word of tradition. It is familiar, comfortable, and it is deeply rooted in our everyday lives. In this word, food has been consumed for generations, and because of its familiarity, we assume it is safe. We trust it without asking questions. However, familiarity is not the same as safety. Tradition can explain habits, but it cannot replace scientific evidence. In this world of traditional foods, many products entered the market long before the modern safety standards existed. They were never required to undergo the strict European safety assessment that is currently demanded for novel foods. And yet, this is also the world where food contamination scandals and long-term health risk and environmental damage still occurred. If traditional foods were automatically safe, these problems would not exist today. Now imagine a second word, a word that is the word of innovation, the word of novel foods. This word is often viewed with suspicion because it is new and it is unfamiliar. Because people fear it simply because it challenges what they already know. But this word is built on science. It is built on transparency and evolution. Novel foods cannot be sold in Europe unless they pass rigorous safety assessments, designed only to protect consumers. Throughout this debate, the opposition team argued that traditional foods are safer because they've been eaten for centuries, but this is not proof. Time is not proof. Long consumption does not guarantee the absence of harm. In fact, many traditional foods have been linked to health and safety issues over only after years of use. Novel foods, on the other hand, are tested before they reach the market, not after problems appear. We also discussed fairness. Why should new foods be forced to prove their safety, while old foods are allowed to rely on history alone? Safety should be based on evidence, not on age. Another thing we discussed on is the fact that curves are important. The other team, the opposition team, stabilized the fact that we actually need a process that isn't that expensive, but actually we should look forward more to the safety of people that to the fact that a process costs too much or it doesn't cost enough. We should look forward to the fact that people could die or get physically ill, and not the cost, in fact, the money that we spend on the process. This creates, then we finally can say that this motion is not about actually rejecting tradition or banning existing food, already existing food. It is about accountability and responsibility. It is about ensuring that every product on the market, whether it's old or whether it's new, meets the same scientific criteria for safety. In a fair system, no food should be considered safe, simply because it is a word always existed. Safety must be proven, not assumed. That is why this House proudly supports this motion.
Grazie, 4 minuti e 12. Aprite i microfoni, fatevi un bel applauso. Interrompo la registrazione così potete effettivamente scambiarvi le vostre idee